want me to begin? Hello, my name is Kelly Long. I'm your Ventura County Supervisor, Board Chair, and District 3 Representative. On behalf of all the Board of Supervisors, I'd like to say thank you very much for staying well at home, following our California State Health Order, and making sure that we just stay healthy in these unprecedented times. I have been singing a mantra lately: masks, distance, wash your hands. 3 easy steps to make sure that we're not spreading our COVID-19. And I wanted to just reiterate our thanks for everyone who's been going to our facilities and getting tested. The moment a couple weeks ago we asked people to get tested, make sure you're not spreading the COVID-19 virus around, and our community stepped up. Our numbers have increased so much. We've had to staff up. We've had to put more pop-ups up. And how is this helping our community? It's making sure that we're not spreading it. Our county, thank you very much. I've been asking to really talk about what is COVID. It shouldn't be a scary thing to talk about. It should be just like flu, and how do we handle it? What is the incubation time? How do we make sure we notify our friends or families if we have it? Making sure that we get a text from your testing that says negative or positive, and then what to do with that. So if you go to VenturaCountyRecovers.org, we have all our frequently asked questions, testing sites, and I wanted to talk about our businesses. Thank you to everyone for contacting us in regards to the concern of the LA County's Public Health Director closing or looking at closing the outdoor dining for restaurants. I really appreciate everyone's understanding of how important businesses are, how they employ our community, and how our community actually use that money for food, housing, healthcare. It's a full circle we have talked about since day one of this COVID-19, and I appreciate everyone really trying your hardest to make sure that we are not spreading it so we can keep our businesses open. A new slogan I like is stay safe, stay open. I mean, we already have stay safe Ventura County, but really it's stay safe, stay open. The majority of our COVID cases are in the public gatherings. It's not where we go to work and it hits everybody. It's really in our public gatherings, and so we need everyone to help us with that. Actually, I'm going to do something a little bit different. I'm going to ask my kids to come up. As we have Thanksgiving coming, the surge of wanting to really bring all of our family together. My kids here, they're not really wanting to be with mom at work today. Everyone's got schools off, but I wanted to take this moment just to be thankful of my family and of my friends and all of your family for sticking together and maybe doing what we don't want to do. We'd rather be traveling and gathering and just breaking bread with everybody. I mean, that's the tradition of Thanksgiving. It's been over 430 years of coming together to celebrate a harvest and to give thanks. And so I wanted to take this moment just to show you that we all are working together on this. Whether you see us on camera, whether you see us on the social media, please know that your Ventura County officials and our staff are working diligently with the state to ensure we stay open. I appreciate Dr. Levin's working with our Board of Supervisors to really understand the issues and see how we could safely make sure we are open. We've seen this in July. We know we can survive this, and so I want to say thank you. I was reading a quote from Sergeant Ron Helis's wife today. Karen Helis, she lost her husband 2 years ago at the borderline shooting, and it reminded me very much that we need to be thankful for every moment. We need to cherish all those around us, all of you here today watching, and to also support our friendships and support our families through troubled times. There's a lot of issues with our COVID-19 pandemic, mental health, physical help, job loss, trying to just get together. And so this is our time for Ventura County. We've rallied before and we'll rally again. So when we get together on Thanksgiving, whether you're having dinner with your family or taking the dog for a walk or having to go to work, please remember that we are staying together and we're going to stay healthy. So I just want to wish everyone a very happy Thanksgiving. And I'm so just precious to be here with you. Today's press conference, thank you. I don't want to make them stand up here too long. So we're going to hear from Dr. Robert Levin, our public health officer, in regards to the update of COVID and what is the surge and what does that mean for Ventura County. As we know, we have a lot of people stating that it's really hitting local. Doing local is what's going to stop this surge. Then we also have Assemblywoman, Dr. John Frankhauser, our CEO for Ventura County Medical Center and Santa Paula Hospital, talking about our hospital, what the status is, and how you can help. And then we have Jackie Irwin, our Assembly member for District 44. She well represents us at the state and appreciate the partnership we have in all that we're doing just to keep our doors open and healthy. And then Mr. Mike Powers, so proud to work with him. I know our board is very grateful for all he and his staff does to really get us through this. So with that, I will bring up Dr. Levin. Hope you all have a very happy Thanksgiving, and it is different. Change is good, and we will get through this together. So stay well and stay open. Thank you.
Good morning. I'm Dr. Robert Levin. I'm the County Health Officer. I'd like to start with updating everyone about the new cases, the new statistics that we've got. We have reported from yesterday 140 new cases. The total tested were about 2,000 people. COVID cases in the hospital at this time are 82 people across our county. For perspective, the largest number of people we've had with COVID hospitalized across the county was about, I think, 103 back with the last surge. The lowest we've been was a couple months ago. We were at 10 cases in our county. There are 17 patients of those 82 that are in the intensive care unit. We did not have any deaths reported yesterday, but we do have a total of 175 fatalities now due to COVID in our county. I want to talk to you for a moment, it's Thanksgiving, about the mechanics of Thanksgiving. First of all, happy Thanksgiving. It may not be as happy as it usually is for most of us, but happy Thanksgiving. This is my favorite holiday. It reminds me of how lucky I am. We all are. For some perspective, we're not plagued by wars with invading armies here locally, though we do have an invisible enemy. We're not suffering from famine, though there are some of us who are food insecure. And let us keep in mind those of us who are out of work, whose business is limited by restrictions, and whose activities are limited by these restrictions. 15 million Americans right now are receiving emergency unemployment benefits. Nevertheless, we're lucky to be born in this place and this time. We have the resources and the understanding to fight back against this infectious disease. We've been born into a time of advancement and enlightenment where we take for granted such things as electricity and plumbing and education, but we're all grateful for these things. Let me give you a specific example of how lucky we are. It's an example of another infectious disease, HIV. Because we're at human development where we are, we're capable of creating a blood test that recognizes infecting viruses that we can't even see, much like we have for this COVID virus. But we've only had this capability for a short time. We didn't have it 104 years ago. If we had the new HIV instead of the swine flu virus back then, what might have happened? The virus can smolder in our systems for 10 years before a person has any symptoms. But during that entire period of time, a person is contagious. And you may know that without treatment, at least 99% of fatality is associated with an infection. What if this had occurred? Just imagine. Without the technology we now have, it would have spread throughout the world. So when I say we're lucky to be where we're at and where we are, we have a lot to be thankful for. But COVID is our reality now. The tools we have to fight it are right before us. Soon we'll have a vaccine, but right now, if we limit our contact and with others, we can limit its spread. Let's talk about the mechanics of Thanksgiving this year in your home, or rather, preferably outside your home. You're going to have as many as 3 households, but no more, at your place. Please try to keep your celebration to 2 hours or less, and try to keep it indoors. And to that end, move it to the afternoon where it's warmer and you're more likely to be able to have an outdoor event. Wear masks and maintain 6 feet of distance between those who are not from the same household. There's still time to get tested for COVID before the holiday. This is not foolproof. It's conceivably, you could be negative today and positive by the time of a Thanksgiving celebration. But it really increases the odds tremendously that there will not be spread at your event. If you're not feeling well, please don't go to the Thanksgiving celebration. And have one masked person who's washing hands frequently serve everyone by bringing the food around and serving people individually. Or better yet, having people come up one at a time to have that server put the individual servings on their plate. Let's also talk a little bit about something that has been misunderstood, I think, and that's the so-called curfew. It's been said that law enforcement will not be enforcing the so-called curfew. And this is not the truth. 41 counties, 94% of the state's population, including Ventura County, have been ordered to shut down from 10 p.m. to 5 a.m. beginning this last Saturday as a result of a curfew that will last until December 21st. This was announced by California's Health and Human Services Director, Dr. Ghali, on Thursday. But don't expect to find law enforcement patrolling the streets, looking to cite or arrest people outside their homes when they shouldn't be. Our sheriff said that our position on the health orders has not changed. We will do all we can to encourage and gain compliance with enforcement only as an option. With the latest order, enforcement is exceptionally difficult, as there are so many nuances to the order. In most cases, law enforcement cannot lawfully stop people to investigate whether or not they should be wearing a mask, whether or not they're walking their dogs with a member of their household, whether they're an essential worker going about their essential business. These people can be outside after the curfew. The sheriff wants everyone to understand all of the law enforcement in our county still has the same approach to the health orders. The idea of this health order is not to limit people's personal freedom. It's to curb late-night outings, parties, and other gatherings that carry a high risk of COVID transmission. It's a way to fight a surge that has the potential to challenge the capacity of our hospitals across the state if left unchecked. It's an idea that is hoped will work as well as a lockdown without as many of the limitations. We in Ventura County are lucky. Many of the counties in our states have no law enforcement backing. Our law enforcement, both county and city, is there for us. Our sheriff and chiefs of police are here for us. If there are the big gatherings that Secretary Ghali is talking about, then you can call the police and they will be there. I think this curfew will mostly be enforced by people's conscience and their sense of responsibility. I don't see a need to issue an order with additional restrictions at this time. I think the state order on top of the new tier assignments will make a difference in the COVID fight. So once again, I wish you a happy Thanksgiving, and I'd like to introduce now Dr. John Fankhauser, who's the CEO of Ventura County Medical Center and Santa Paula Hospital.
Thank you, Dr. Levin, and thank you for your leadership and the entire public health team for their work during this unprecedented time. I'm glad to get a chance to share with you on behalf of our hospital staff and physicians how things are going at your county hospital. We have two county hospitals, VCMC and Santa Paula Hospital. And we are at this moment very, very busy. I do want to reassure you that the hospitals are safe. We've taken tremendous care to be certain that we're able to care for folks who come in with ankle injuries and appendicitis and those non-COVID related illnesses. And we have the capacity to do that as well. We're catching up on some of the backlogged surgery and diagnostic procedures that we had to put on hold during the early days of this crisis. And that work continues every day. And I guess I'm just wanting people to recognize that for us to continue that, we need to maintain capacity. And we've done a great job of building capacity in all of our local hospitals, but it's not infinite. And in order for us to continue to care for patients, we really need the partnership of the community in order to reduce the number of COVID patients and flatten this curve. COVID patients or COVID numbers in our hospitals are surging. Dr. Levin reflected the numbers in the community. 12 days ago, we had one COVID patient in our two hospitals, and today we have 16. I know I've been out and talked to the community, and I realize that people have a sense of invulnerability. People think that this is a disease that only affects the elderly or those with severe medical conditions. But that's not what we're seeing at our hospital. Of those patients, of the 16 patients in our two hospitals, 10 of them are younger than I am. We have two patients in their 20s. We have one patient who's in her 30s, and we have 6 patients in their 40s. So I just want to reflect that to you and ask you to take a minute and let that settle. This is an illness that we are all susceptible to. And if you think that it can't touch you or it can't touch your family or it can't touch your close friends, that's just false thinking. We really need to, more than ever in the last handful of months, go out of our way to protect our community. I know that we all have COVID fatigue. It's a thing. It's a real thing. And our hospital staff is also experiencing COVID fatigue. I'll just share a message that for them it's disheartening to go into the community and see people having large gatherings in their backyard with 4 or 5 families coming together. We're there for you at 3 in the morning when you go into labor. We're there for you at 4 in the morning when your child has appendicitis. We're there for you when you develop pneumonia on a holiday and have to come to the hospital. Our staff drop what they're doing and come in and care for the patients of our community. And we would just ask that in exchange, the community takes the measures that you all know are needed in order to prevent the spread in our community. We've seen recently, I think, and gain more appreciation about the use of routine testing in our community. And with the help of public health and Dr. Cho, who's leading the ambulatory care system, and Barry Zimmerman and others, we've just had a tremendous expansion in our capacity for outpatient testing. Some of you may have heard Dr. Deborah Burks, who is one of the coronavirus response coordinators in our nation, reflect on what measures she sees that we can implement that hadn't been implemented early on in the crisis. And she's really focusing on routine testing in communities. We've seen in college campuses where they tested students every 2 or 3 weeks routinely, dramatic decreases in the number of cases on campus. And I know I've heard previous press releases where you've been urged to, every 2 or 3 weeks, get tested. What we know is the first 2 days when you're spreading the virus, if you get infected, you have no idea that you're ill. The most contagious period during this disease is the 2 days before you have any symptoms and the 2 days after you have symptoms. So it really makes you only capture half of the cases if we only test people who are symptomatic. So I just urge you to consider getting routine testing in the community. And am grateful for the fact that we can now offer that in such a large scale. So on behalf of healthcare workers, I'd just like to again ask that you avoid large gatherings, avoid gatherings that mix family units. I think our public health officer at the state level, Dr. Pan, said it well when she said, every intervention to decrease mixing of households is critical during this unparalleled increase in case rise of about 50% during the first week of November. So I just urge you to take heed. Physical distancing, we know this virus doesn't travel long distances in the air, so physical distancing, mask use, hand washing or the use of hand sanitizers. And we did this in the spring. We did this. We flattened the curve in the spring. And I just urge you, particularly during this time of celebration and holiday, to do what we can for our community and flatten the curve. And then finally, I just want to reflect on my own personal gratitude during this season. Although I won't be able to spend the holidays with my family, that would require traveling, I just want to express my gratitude for my family, for whom I'm deeply, deeply grateful. And also want to express my gratitude for Ventura County, my home, for more than 30 years. And for you, the members of the community who are my neighbors, I am truly grateful for you. Thank you. Next, I'd like to introduce Assemblywoman Jackie Irwin, who's worked tirelessly on behalf of our community to help us control this outbreak. It's my honor.
Good morning, everybody. My name is Jackie Irwin, and I am the Assembly member representing Ventura County in the state legislature. I want to start off by thanking the county and all the phenomenal work it is doing, and all our frontline workers, especially our medical workers who are putting themselves at risk every day to protect our county. I'm here to provide a short update on some of the work my office is doing during this pandemic. This has been an incredibly difficult time for many of our residents in Ventura County. They've lost their jobs and they're worried about where their next meal is going to come from. My staff has taken literally thousands of calls trying to connect constituents to the services that they need, including dealing with the DMV. But one area that we have been especially busy with is EDD and the unemployment insurance system. Our office has been fielding calls since March and has been able to help hundreds of residents here in Ventura County. I know it's beyond frustrating at times. They've had staff shortages and struggles processing claims. But I do want to tell you that our office now has a EDD liaison and can provide constituents with more direct response to their inquiries. So please give us a call if we can help you with your claim or with any other state agency. And our number is 805-482-1904. You can look that up on the internet. One of the biggest projects we've been working on is the COVID-19 antibody study, led by a diverse public-private partnership in Ventura County. We're trying to get answers to two major questions. How many people in the county have antibodies, and how long do antibodies last? Since May of this year, researchers from CLU, UCLA, UCI, Levin Health have been collaborating with Ventura County agencies, including the Ventura County Healthcare Agency, Oxnard Fire, Ventura Fire, the St. John's Hospital, and that has all been supported by the Ventura County Community Foundation. And what we have done is, in this effort, we have gone a long way to ensure that your local and state officials have actionable data on the spread of COVID-19. During the first 2-week testing period, the county tested over 13,000 individuals for antibodies. And special care was taken to oversample those communities that are most vulnerable: our frontline workers, our homeless, our healthcare workers, and our farm workers. In the last 2 weeks, we had another countywide testing effort, and we certainly appreciate everybody that came and got tested. If you want to find out whether you have COVID antibodies for free, you have one last chance tomorrow, and that is in the city of Ventura at De Anza Middle School. Antibody testing is going to be available from 11 to 5:30 p.m., and no appointment is necessary. It will be on a first-come, first-served basis. A few weeks ago, I hosted a COVID-19 town hall with our very own Ventura County Public Health Officer, Dr. Levin, and a representative from Pharma. The big takeaway has been that there has been an extraordinary and unprecedented U.S. and international worldwide effort to get a safe and effective vaccine on the market as soon as possible. And as most of you have heard over the last few weeks, there have been some very exciting developments. What we heard during our town hall from Dr. Levin is, for the general public, vaccines will probably not be available till mid-next year. When it's my turn, I will certainly roll up my sleeve and take that vaccine. But in the meantime, I would urge all of you to get your seasonal flu vaccine, because that's the best way to protect yourself in the short term. Dr. Levin also talked about the infrastructure that's already in place here in Ventura County and the infrastructure that's being developed. We are very lucky to live in a county that is going to be ready when the vaccine is ready. If you would like to watch the town hall, it is on, you can see the link on my website. And finally, there are so many individuals and organizations that have stepped forward to help those in need in our county. But the nonprofit that has probably stepped up the most to meet our most basic needs is my 2020 nonprofit Food Share. Food Share has been leading the fight against hunger in Ventura County for over 40 years, but they have truly proven the power of their mission through meeting the increased demand of hungry families brought on by the COVID-19 pandemic. Their work in distributing about food to about 750,000 individuals since the beginning of the pandemic has played a vital role in holding our community together during its greatest hours of need. So I want to thank you for having me here today. I want to remind you to support your local businesses. My refrigerator is full of beer from our local breweries. We have seen time and time again how we all come together during tough circumstances in our community, and we will continue to do so through this pandemic. Be safe and be kind to one another. And this Thanksgiving, let's be thankful for all our blessings. And now I would like to introduce our fabulous county CEO, Mike Powers.
Well, good morning, and thank you so much, Assemblymember Irwin. Wonderful to have you here today, and it reminds me too that I think it's important that the community know just how much communication we have with Assemblymember Irwin's office, with our other state legislators, with our federal legislators, our local, all of our 10 cities, regular contact. We have a regular weekly call with all of them, our board, and the fact that our Board of Supervisors and our state legislators and federal are advocating on a regular basis for what's happening here in Ventura County. Issues around the need for PPE, testing resources, the impact of health orders on our local businesses, making sure that as folks in Sacramento are making their policy choices, they know what that means actually right here in the field to our community members, one person at a time. And I can tell you it happens regularly, nights and weekends, and we really appreciate that leadership and support, and it's just constant and unwavering. Also wanted to thank you, the community, for what you've done in terms of testing. As you heard Dr. Levin say, until the vaccine is here, and it's coming, which is very exciting, really the only weapons that we have to battle this virus are testing, tracing, and isolating. So how have you been doing? Well, here you go. You can look at this chart right here. Just to give you a ballpark idea, we've been doing about 5,000 or 6,000 tests a week. Now you can see we're up to 24,565 tests over the last week, 40,000 over the last 14 days. So that is a quadrupling, and that's all about you and the work that you're doing, our community. And so we really so appreciate it. And we appreciate your patience too, because we know as more people are getting tested that the lines are getting longer. But we want you to know that we're continuing to add resources, whether it's staff, tests, hours, take-home tests, whatever it is. Try to help meet that demand. And we know it's really spiking right now, especially with the Thanksgiving holiday coming and everybody wanting to be safe with their families and so forth. So again, we really appreciate all that you're doing there. And it's one of those bad news, good news things. The bad news is we're seeing cases. But that's also the good news, because without that testing, those cases are in the community. People, most of the folks who have it don't even know they have it, and they're spreading it. And that's a huge challenge for our community. So how can you help our community's health and our local businesses get tested? And that's how you can see, everybody wants to know what can we do. And so you can see here, just to give you a sense, I don't know if this slide up. Thank you so much. So these are the metrics that we measure, and you've seen them before. I'm going to highlight the one down the bottom left. The state standard is 150 per 100,000 per day. We'd been up to 300. We're now up to 551 tests per day. That's one of the highest in all of Southern California, and I just hope you take some pride in that in Ventura County, because that's each of you making that number go up. So as I said before, we're catching more cases, but they're there. Question isn't, are the cases there? They're there. Now we're catching them, tracing and isolating and stopping the virus in its tracks. That's what's going to help. We're mid-surge right now. Okay, well, what are we doing about it? This is what we're doing about it. And so we really appreciate you helping with those numbers. Our case rate is higher than we want it to be, but we're also getting a very favorable adjustment factor. So actually, our county's case rate is one of the lowest in the Southern California region as well. It's higher than we want it to be, and it's higher than it needs to be to get us back into the tier, but it just still shows that Ventura County is really outpacing most in the state, and we appreciate that effort. As you can imagine, there's testing at this volume is putting a strain on the system, in terms of the staff, and resources financially. It's a big investment. We budgeted very conservatively. Our Board of Supervisors did, so that we would have funds that could last, so we had sustained this, and we're continuing to do that. And we're also working with our Office of Emergency Services and Healthcare Agency to diversify the supply chain, because that's another piece of all this. We're testing at a very high rate, as many counties are now, so the demand's gone up. We want to make sure that supply chain sustains going forward, and that is happening. And we also want you to know that I know if you're in line, it's tough, but at the same time, we want you to know we have more capacity in our county in Ventura here than most counties. And in many counties, the waits are 5 and 6 hours. Some, they don't even have drive up. It's by appointment only. So we really we've invested in much more capacity here. So it's that capacity combined with your community support that's helping us get these numbers where they need to be. And we pledge to you, we're going to do everything we can. We're going to pour all our resources and energy to keep sustaining this level of resource for testing for our county going forward. It is Thanksgiving time, and as been said, we just really want to thank all those workers who continue to work to look out for our community 24/7 and who have never stopped, from our healthcare workers to our grocery clerks, to all those community helpers and volunteers who are out there who just continue to look out for our community during this really, really challenging time. And our businesses too. We got the good beverage support from Assemblymember Irwin. That's good. But again, it just speaks to shop local. And one of the things we want to remind folks is in the purple tier, it's more restrictive than we'd like, of course, but there's still a lot of businesses that are open. So please go check out on VenturaCountyRecovers.org. There's a list, and you do have to check it twice or more to really absorb what's on there. But, for example, retail is still open. Restaurants still open outdoors. Personal care services, hair salons open indoors. So our businesses have been there for us during challenging times, and we need to be there for them during this time, and I know that you are. And so I know that we'll shop local as we go forward. We've also, in this time of Thanksgiving, heard a report on the wonderful work of Food Share in feeding our community, and we're so grateful for that. We also want you to know that our board has invested $1.2 million as well with Food Share through December, so that we can have additional pop-up sites throughout the county, as well as weekend and evening hours for folks who can get their off when they're not working. So it's very important to our board. And our Ventura County Area Agency on Aging has I just think it's a really beautiful program, working with local restaurants, working with the Great Plates program to provide Thanksgiving meals to homebound seniors. And it's wonderful. And then so many folks, including kids in our community, have written cards, holiday Thanksgiving cards, that will be included with these meals. And it's just, I don't know, it just speaks to the spirit and the soul of our community that these homebound seniors are going to get a meal, a card, and also a porch check-in, some socialization, which is what we all need right now with all this isolating happening. So really appreciate AAA, really proud of, there's over 130 county employees who have volunteered to do this as well. So it's just our community coming together at a time when folks are in need. So we talk about resources. Just want to, again, highlight 211 is a great resource for folks. Whatever you need, 211. Please do check in with them. They have wonderful health, mental health, social services, and housing resources available. And then also, I would remind you to stay connected, but we know that you already are at VenturaCountyRecovers.org. But also, if you're struggling during the holidays, it's not uncommon normally, but this is certainly not a normal time. So wellnesseveryday.org, wellnesseveryday.org. There are resources there for you. If you're feeling isolated, feeling like you need to talk to somebody, that's what the resources are there for. Please take advantage of them. Last, I would just say, we talk about Thanksgiving and giving thanks. I'm just incredibly grateful for my family, my friends, my county family, and I'm incredibly grateful to work and live in a community where our community cares so much about each other and those in need. And so with that, I wish you a very safe and healthy and happy Thanksgiving. Take care.